Well, the West Ohio Food Bank is working on their strategic plan, and they've got a partnership for a new pantry. We're going to learn about both. Today, to my immediate left, we have Berlin Sherrick, and he is with Lima Memorial Health System, and then, of course, Tommy Harner, the CEO of West Ohio Food Bank. So thank you both for coming today.
Thanks for having us.
Okay, so Tommy, let's start with you. The food banks are working on strategic plan. Now you're kind of focusing in a little bit more with focus groups. Tell us about that.
Yeah, so we're going to be scheduling different focus groups so we can hear from those individuals that we serve, because it's very important as we're developing our work and our goals and our objectives to know what is it that that end result needs. So we really want to have their voice at the table and just do these throughout our service area and have some good feedback to build that plan.
So how are you getting feedback? Are you going to bring people in? Are they supposed to take a survey? What kind of things are you doing? Yeah,
so we're going to do both. We're going to bring people in, and again, we'll do that throughout our 11 counties. That way, not everybody has to come to us, but we'll go to them. Okay. And then we're also going to conduct a survey during our distributions throughout those counties too. That way, if someone can't participate in that focus group, because those will be a little smaller, they still have the opportunity to be heard.
Well, you know, and you keep saying that there's more and more people that are coming for help. So I guess you just want to know what kind of help, or are you filling the needs, meeting the needs of the people? Right.
I mean, as things are rapidly changing lately, we're seeing an increase, continuing increase that we have. Like over last year, it's 11% up just in the January and February months, and a 6% increase in the new individuals during that time too. So we know it's new faces coming in, and again, just to hear, you know, how can we make our services better and what more may they need.
And speaking of services, you know, do we need to contact our lawmakers and things to keep them in mind that, you know, you need the farm bill, you still need this support as we're hearing about cuts all over?
Absolutely. Any of that kind of advocacy that individuals can do for us, we are very appreciative of it. We have talking points that we can provide to individuals, and even templates if they want to contact lawmakers.
All right, so, you know, filling the needs through distributions, but also you see needs in the hospital. So let's talk about this new pantry that you guys are setting up in partnership with the West Ohio Food Bank.
So like Tommy stated, the needs of the patients are continually rising, and one of our strategic initiatives is to assist patients as they're being discharged with food securities, food, nutritional food that will help support them over the discharge, help them with the recovery, possibly avoid a readmission based on that. So we partnered with the West Ohio Food Bank. They graciously helped us with refrigeration, freezer capacity. We created a space, we created a distribution network for our patients as they're being discharged. Those that we assess through care coordination that need food assistance will get that through Lima Memorial.
All right, so it's not a pantry where you want people walking in. These are your patients that you realize, I mean, you know, we always hear, oh, what you eat matters with your health, and so I guess you guys can really help teach that to the patients that, you know, this is what you need to go home with.
Right, absolutely. So the patients will be discharged with those that have food insecurities based on their diagnosis and based on what they need to continue to recover. So if they're a diabetic, they'll get diabetic care. If they're, say, heart healthy, and they'll have food along that line. We also are going a little bit beyond that and offering toiletries, laundry items, things that will help them around the house and continue can openers, refrigerator, temperature thermometer equipment, because we want to make sure that they're eating safe food, the food stored at the proper temperature, they're able to open the food, so just, you know, whatever they need, we're trying to help them out.
Well, and you know, like you said, you don't want them coming back. I mean, if you can help fulfill the needs, and you know, we want a healthy community. We're always learning that from, you know, from the food bank to Activate Allen County to the hospitals. You need to work on this food.
Absolutely.
Yeah.
It's great.
It is great. And so the partnership, is it fun for you to be able to do something new like this to help out like what the hospital is doing?
Oh, absolutely. Because we are going in the direction of food as medicine and trying to address those health disparities and their correlation with food. So this partnership has been great. It's taken a little while to come to fruition, but now it's going, and we was talking in the lobby of just some other things maybe we can do in the near future.
Tip of the iceberg. Thank you both for coming today.
Very much.
Yes, thank you.
All right, don't go away. New Edition continues in a moment.